Okay, hi guys, it's Peggy Yee here with Frankly Realtors, and we are here with our latest local business spotlight interview. And today I'm excited to welcome Dr. Karen Kaufman from Kaufman Allergy. So Dr. Kaufman is a double board certified allergist and immunologist and is opening a local practice here in Vienna in January 2021. So she helps children and adults with allergies and recurring infections to reduce their symptoms and the need for medication while improving their quality of life. So definitely sounds very important and very exciting to have her on with us today. So welcome, Dr. Kaufman.
Thank you. Hi, how are you, Peggy?
I'm good. I'm good. So tell us a little bit about like how you got into this, like what's your background and how you got here.
Oh, that's such a good question to start with. So, my background is that after I went to my undergraduate, I went to medical school right away, and I'll just give you a short little story to go along with this. So, at the time I was applying to medical school, I was trying to figure out how I was going to pay for it. And I was really overwhelmed with the thought of the burden of student loans and, prolonged debt. And so I was looking into different options, and I had decided that I wanted to pursue a scholarship from the military. And this happened right around the time of 9/11. And interestingly, I was offered my scholarship on October 1st. So just a couple weeks after 9/11, which was such a tremendous time to be going to medical school and to be, starting to learn how to serve others in a greater capacity. And at that time, I decided, I think a lot of us had this inner feeling of service to our country more at that time than ever. So I joined the military and got a military scholarship for medical school. And after medical school, I went on to do my internship and residency at the Naval Medical Center in San Diego, where I learned internal medicine and practiced that for a couple of years before I went back and did my subspecialty fellowship training in allergy and clinical immunology. And then after I finished my fellowship, I went back and continued to serve the Navy for a few more years and joined civilian practice in 2015. So I've been, at that time, my family moved here to Vienna, and I've been practicing in the Northern Virginia area for the past 5 years, but have always had a dream of having my own practice. And I'm so excited now to open that practice right here in my own hometown.
Awesome. That's so great. Well, thank you for your service. I didn't really realize that about your background. So
Thank
that's
you.
amazing. That's
Well, it's
great.
interesting. I think, that background of service to our country and to the community where we live is such a deeply woven thread through, the way that I am in general, but also the way that I practice and have that continued commitment to serving others.
Yeah, awesome. Perfect. So tell us a little bit about like what makes your practice unique. I see that you're board certified. Like what does board certified even mean?
So, a board certification is a trusted stamp of approval for physicians who are experts in their field, and they go through, of course, the appropriate training, but also rigorous testing and continued education over time. So I have two board certifications: one in allergy and clinical immunology, and I have a second board certification in internal medicine, although I don't practice clinical medicine any longer. But I still thought it was an important certification to keep up over time. But I think when you see a physician who's board certified, it just gives you that extra stamp of approval that that provider is meeting the benchmark of standards in their field. So.
Awesome. Yeah, sometimes like you don't know what to look for, right? Especially if you're like choosing a doctor or you're getting recommendations or you're looking online. Like so, just having that board certification sounds like that's definitely something to look for in a doctor that you're looking for.
Yeah, I think it matters. I think, when I look for a doctor for myself or for, my children, my family members, not only am I really looking for that, mark of clinical expertise, but I'm also looking to see, what their patients say about them. So I think, one of the things that sets my practice apart from others is that I truly believe that patients need to be heard. And I think that, in reading testimonials, people will see that I'm a very compassionate listener, and I spend my time really studying my patients' histories and learning about them and listening to them and making sure that, as we move forward to figure out and fix the problems that they're seeing me for, that those patients feel like their problems are heard and their questions are answered. And that leads a lot to patient satisfaction. But it also is a lot of self-satisfaction too, because, I feel like you see this all the time where people go to a provider and, they feel rushed into the office and they're in and out of the office, before they can blink, and they leave with a prescription for something and they're out of there, and they leave feeling like, I didn't get my questions answered, and like, I don't even know what happened. And that happens way too often. And so I think in my practice, you're just going to find that we do it the right way, and people really feel that satisfaction when they leave at the end of their visit.
Yeah, awesome. Especially I would think with allergies, right? It's not just kind of a cut and dry, I have a cold or ear infection or something like that. It must be like there's probably a lot of cases where it's like all the details kind of matter, right?
Yeah. Oh, yeah. The details totally matter. And, what's interesting with allergy in particular is that there's so many ways to find solutions for patients. And most of the time, by the time patients get to my office, they've already either, gotten a treatment plan from their primary care, or some of them even feel like, their allergy needs maybe even sometimes blown off by their primary care because their primary care doctors are so limited in time and have so many other, maybe sometimes more pressing things to address, or even things like routine screening or health maintenance, things that have to get done. And so, then they tend to like get advice from their family members or their friends or from social media, and they've cruised the aisles of the drugstore. They've tried all the over the counter stuff, and then they come to me and they're like, what do we do? So there's a lot of different ways to manage allergy. And some of it is simple stuff like easy environmental control measures that can be implemented at home. And so, without having those advanced diagnostics to be able to really say, what exactly is it that we're dealing with, it's really hard to kind of take those next steps. So, overall, my goal with patients is to minimize the medication burden that they all experience. It's very easy to, go to a doctor's appointment and then it's add this drug and add that drug and take this and take that. And you leave with like 10 more things. And it's like, oh my gosh, I don't want to do that every day. And so sometimes there are kind of, more advanced solutions, even things like allergen immunotherapy, which is what we refer to as allergy shots, which really definitively reduces patients' symptoms, reduces their need for medications, and improves their quality of life over time. So there's lots of really nice modalities that we can offer beyond what you can pick up at your local drugstore.
Awesome. So can you like share with us something like what I guess I have two questions, I guess. One would be like, what's the most common thing that you see like patients coming in for? And then the exact opposite question, like what's a really unique case that you've had to like diagnose and like that was really complicated?
Oh, sure. I've got all of that stuff. Well, I will say, so I see a lot of things commonly. So I wouldn't say that there's one most common thing, but I would say some of the more common things include environmental allergies, asthma, food allergy, evaluation and management, absolutely. I take care of a ton of skin stuff like atopic dermatitis, which is what we call allergic eczema, contact dermatitis. So I do advanced diagnostic testing for that. And also, I see a lot of patients who experience hives and swelling, both acutely and chronically as well. So I would say that's probably the array of the more common stuff that I see. Chronic cough, that's another one, super common. Um, Maybe a little less common, I see folks who have recurrent infections. So when we talk about problems of the immune system, which are very popular questions that people have now in the light of, right now this interview is taking place during our COVID-19 pandemic, and we're right on the verge of vaccination. So people have a lot of immune system questions for me. But often when I see patients with primary immunodeficiencies or immune system disorders, that's going to present with symptoms of recurrent infections that sometimes are either more severe than they ought to be, or they may be prolonged infections, or infections that have unusual features to them. So that's often how majority of immune deficiencies will present. So when I see somebody, and sometimes it's patients who come in maybe for the routine stuff, for the regular stuff. And as part of, taking a thorough history, I always ask about infections. And sometimes when I get that history, like, oh yeah, like I get 5 or 6 sinus infections a year. Like there is nothing normal about that. So especially in this day and age, it's very easy to maybe see your primary care provider once, but maybe the next time you're sick, you'll go to urgent care. And then maybe you'll see, somebody at a different facility or maybe a different provider in the same group. So there isn't that same continuity of, gosh, you're having this a lot. It's just, oh, you're sick, take this. I hope you feel better soon. And if you don't, come back. So, what we do is we kind of take that step back and say, okay, this is not normal that this is happening to you. Let's figure out why it's happening. And as we evaluate patients' immune systems, it's actually very often that we can do some pretty easy things to make dramatic changes in the way that people feel and people live. So sometimes it's fixing relative problems, and sometimes it's diagnosing more, longstanding problems that if we didn't do that evaluation, they may go missed, upwards of 9, 10, 11 years of, patients being sick all the time, missing work, missing school, feeling like they're not well enough to play with their kids or to go outside. And, that's really just not a way to live. So while that's something that I do a lot as a clinical immunologist, that stuff overall isn't super common, but it's more common than you think, that's for sure.
Mhm.
Um,
Yeah, I can imagine that of like maybe somebody just thinking, oh yeah, just every year I get this, or oh, I've just always had it that way, and it's like, oh no, you don't absolutely, that doesn't have to happen.
right. And sometimes what it is it's people who are clinically healthy until all of a sudden they're not. And then it's like, oh, well, since 3 years ago, now I've had all of this stuff and I can't figure out why am I sick all the time.
Mhm,
Well, there's
mhm.
usually a reason for
Yeah, yeah,
that. So we work on all of that stuff.
awesome, awesome. So yeah, what's a kind of unique case that you've come across, like, or a memorable one?
Um, I'm going to tell you a short little anecdote about a patient whom I've been seeing for quite a long time, and he's just a neat guy. He's in his mid 40s, and middle, kind of getting into that big part of middle age, and had a long-standing history of allergies. So when he came to see me for the first time, the note in the chart said, new patient evaluation for allergies. And so then when I went into the visit, I realized that it was just so much more than that. So, certainly he's a complex guy and has a history of environmental allergies and asthma that was reasonably well controlled. But he also has food allergy. And then he said, I've had this other thing that has been really tricky to diagnose. And I said, well, tell me about it. And he said, well, it really goes back and it started when I was in high school. I'm not going to tell you all that stuff. And I said, no, like, go ahead, like, tell me about it. That's important too. So this gentleman had really terrible symptoms for a very long time of recurrent abdominal pain, like severe abdominal pain that was so terrible that it would land him in the ER from time to time. He even had an appendectomy, which is when your appendix is taken out because they thought maybe it's appendicitis, and it wasn't. It was totally normal. And he had seen multiple gastroenterologists. He's had colonoscopy after colonoscopy, and nobody could put their finger on what was going on. And so, after seeing multiple people for the same problem for a long time, he kind of felt like, I'm going to stop bringing it up because no one knows what it is. And I keep getting blown off. And, I just have to deal with it. But he was missing work like a couple of days per week, which is crazy when you think about it. I mean, that's a tremendous amount of morbidity. So I said, well, let me think about it. And so, interestingly, there is a type of swelling disorder that some people have that is not common. It's a genetic inherited problem, or it could be a sporadic mutation, but we call it a hereditary problem of angioedema or swelling. And these individuals don't necessarily have to manifest with external swelling. They can have all of their swelling in the gut. And I
Mhm.
said, look, I wonder if this is what's going on with you. I said, look, let's do a workup and we'll figure it out. And sure enough, that's exactly what this gentleman had. So we put him on a specific type of medication to help prevent episodes. And he also has a rescue medicine for when he still has what we call an abdominal attack, which he might have 2 or 3 times a year now. But before it was like 2 or 3 times a week. And
Oh,
the entire trajectory of this patient's life changed in that moment. And he has just been doing fantastic since then. So, that's just, that's an oddball one because it's not a common disorder. In fact, I think he's probably, one of maybe 5 or 6 patients I've ever treated with that disorder in my, in my history of being a physician. But it's something that you have to think about. And so, if you don't pick it up, right, you run into folks like this who just have a ton of problems for a very long time. So anyways, he and I have a great, physician patient relationship because, he's just a totally different person now, which is so cool.
yeah, yeah, that's amazing. Like he had to have his appendix out for like the wrong reason. Like that's
Right.
crazy.
It's crazy. I know. As soon as he said that to me, I said, I know other patients who have been through that too. I said, yeah, I think I know what we need to figure out. So
Wow.
that just goes to show that, it's that history that's the most important thing. And my patients know that, and that, they have to, go through that story with me for me to be able to tease it all out sometimes.
Yeah, and just hearing you talk about it, like just being able to like go back through like his high school story, and even when he's lost all hope, it's like, hey, just show me, share with me what you're doing. So no, but it sounds like, yeah, that having somebody also just understand that it's not always like the overt symptoms, right? Like that it's what's happening internally could be something totally different. So just knowing those nuances and having somebody be able to like distinguish all those little things is great to have on your team.
Absolutely, absolutely. So yeah, I think that just goes into to show how important it is to not rush through these visits, right? You have to take the time to be a good listener.
Yeah, yeah, awesome, awesome. Well, so what would you say if somebody is just like having like, let's say my child is having like allergy symptoms and I tried all the over the counter stuff and I just don't know what to do. Like, what should I do next?
Sure. So the next step is to see an allergist. So, it depends on what your health insurance is. Sometimes you do need a referral from primary care, but sometimes you can just reach out and make an appointment. So, for yourself or your child or whomever. And so, during that visit, what's going to happen in addition to taking that great history is we're going to get set up for testing. So, allergy testing comes in a lot of different forms, but it's actually very, very easy. It's minimally invasive. It's not painful, and it takes a very short amount of time to get a lot of answers. So in our office, we often will start with skin prick testing, which is what it's called when we do, sometimes people will call it a scratch test. But we use these tiny little devices that very slightly introduce a tiny bit of allergen into the skin surface, and we see a local reaction there. That entire test takes 15 minutes. So it happens during an office visit, and patients leave with answers, which is awesome. There are some other types of testing that we do, like, for example, the testing for an allergic contact dermatitis or a contact allergy that is a little bit more of a long-term test because the mechanism is different. The mechanism with environmental allergies or food allergy is immediate hypersensitivity, so we get those immediate responses. But in this case, it's a delayed hypersensitivity, so it takes a little bit longer. So patients will go home with a patch on their back, and then they'll return for that follow-up for reading and everything. So those are a couple of different types of allergy tests that we do. But we also do testing and evaluation for asthma in our office. So that's really important. Of course, that's been a little bit skewed in the setting of this COVID-19 pandemic because any kind of respiratory testing spews a lot of droplets into the air, which is something that we're all trying to avoid right now. So right now we're doing it on a little bit more of a limited basis, but that'll come back to full speed at some point. So respiratory testing is definitely part of what we do. And then another type of test that we do a lot in the office is drug allergy testing. And this is most important for individuals with a history of penicillin allergy, which is so fascinating because if you ask around, you'll find plenty of people with penicillin allergy. By far, it is the most common drug allergy reported in the United States. And interestingly, only about 1% of people with penicillin allergy will have that allergy throughout their entire life. And so when we are able to evaluate those individuals, often it's that we are ruling out their penicillin allergy. And that's such a nice thing to be able to do for someone because then we can kind of cross that allergy off of their list and open the doors for treatment in the future if needed. So that's something that we do on an elective basis, but that's a nice thing to be able to offer.
Awesome. And do people ever grow out of their allergies? Like if they had like a food allergy when they were younger, like is that common or not?
It is common. So many individuals with food allergy will grow out of their allergies with time and avoidance. Some of them will more persistently carry into adulthood. We see that more often with things like peanut and shellfish and tree nuts and things like that. They tend to persist a little bit more than some other food allergies, but even children with those allergies will sometimes grow out of them. So the biggest predictor of that is going to be mostly time and avoidance and a little bit of luck on your side. So that does happen. Environmental allergies will change over time, especially depending on where your geographic environment is and also exposures. So this happens a lot with individuals who maybe travel or live in a place and then move back, or maybe go off to college and then move back home. So they kind of change their geography, and then sometimes upon return they'll be a little bit more symptomatic than prior. Or sometimes it's people who bring a new pet into the household. Maybe they've had like a remote history, and they think, oh, maybe I had itchy eyes when I was a kid around somebody's dog or something like that. But then, of course, we live in a pandemic and no one's going out of their house and everyone's getting puppies. And now it's like, oh my gosh, I have terrible symptoms. So, sometimes they're growing into their problems versus growing out of it, but it's all variable. So yeah, I would say the biggest thing that's going to change environmental allergies over time is experiencing allergen immunotherapy or allergy shots. And that for sure will make a tremendous change to reduce symptoms significantly. Sometimes it doesn't completely make things go away, but for some people it does. But certainly, someone who, let's say, was taking maybe 6 medicines to control their allergies on a regular basis may go down to maybe 1 as needed or 2 as needed or something. So even if they still needed a little bit, it's a substantial improvement compared to where they were.
Yeah, that definitely sounds better than six.
Oh yeah, for sure.
Yeah.
And there's side effects of all that stuff too, right? So, being on less medicine overall is a good idea.
Yeah. And that's great to hear from a doctor, to say, hey, less medicine, let's try to like do preventative stuff and then deal with anything else.
Sure, especially in kids too, and I think as a mom, I really can relate a lot to, my pediatric patients and their parents and what they go through. And there's a lot of fears that go along with allergy and, the management of allergy in kids. And it's hard when you're the parent. Actually just last week, a girlfriend of mine who I know through sports had texted me, and her son, who has a known peanut allergy, had an accidental ingestion and was having a reaction. And, it's at that moment that sometimes, like, it just, especially if you haven't experienced it before, it gets really scary. And so she called me and I walked her through, using that epinephrine auto injector and how to do it and getting to the emergency room and all of that stuff. And so, it's a scary thing. So as a parent, I totally understand that. And I can empathize with them, I think, in the right way to be able to know how to help parents and also to know how to talk to kids, because that makes a big difference too.
Yeah, and one of the things that I noticed with talking with you right now is how you're able to like distill probably very, very complex topics into like something that like the average person like me who has no idea about allergies is like understands what you're saying. So definitely, and that's so important, right? To understand what your allergy is or what to do. So
Absolutely. Yeah. I've got a lot of analogies, that I've kind of made up through the years that really help to kind of map things out. And gosh, it's also super commonplace for me to just grab a pen and draw a diagram on the table paper or something like that. Just, I'm a very visual learner. And I mention this to my patients all the time. So my husband is an airline pilot, and his background is as a military pilot. But one thing that pilots do, which a lot of people don't know, is that when they learn how to fly a new airplane, they get a big giant diagram of what it looks like in the cockpit, and they tape it on the wall like a poster, and they pull their chair up, and they literally role play and go through the motions of exactly what they're going to do for all of their emergency procedures and all of the things that they do, and they kind of visualize it and they practice it. And so I love this example, because every single thing that I deal with and that I need to teach patients about is all this internal and microscopic stuff that you can't visualize, and most people don't have a good mental picture of what it is. So, when I teach patients about asthma, it's commonplace for me to call the bronchial tube a bicycle tire, right? So we always talk about a bicycle tire. And then when we talk about inflammation, we talk about a monster truck tire. So, there's lots of ways to kind of make these comparisons to things that we've seen and to things that we recognize, because otherwise it's really hard, to talk about cells and mediators and cytokines and antibodies and all of these things that don't really mean much to us. We've heard about them, but it's not meaningful unless you really can absorb it. So we do a lot of diagramming and a lot of metaphors and things like that, and I think it works. People like it. So
yeah, and plus that probably gets the kids on board with whatever treatment later anyways too, right? When they understand what's going on and they're on board with it. So.
Oh yeah, it's so nice. I love it.
Yeah. Well, thank you so much for talking with me today. I think that we covered a whole wide range of topics. I learned a lot, so thank you so much. So if somebody does want to contact you, what's the best way to reach you?
Absolutely. So right now, the best way to find me is going to be a couple of places. So my website is kaufmanallergy.com, which is KAUFMAN allergy.com. And on my website, for those who are interested in seeing me in my practice, right now there's a link that future patients can click to get on a list for early appointment scheduling before the practice even opens. And once we're up and running, patients will be able to request appointments or even schedule appointments directly through the site. So that's a great site to know. I am on social media, and so you can find me on Facebook at facebook.com/Kaufman Allergy, and on Instagram at instagram.com/Dr.Kaufman Allergy.
Okay, awesome. And then just for our viewers today, I will put all of her contact information in the show notes below, so you can click on all the links there to reach Dr. Kaufman also. So thank you so much for being here tonight.
Thank you, Peggy. What a pleasure. Thanks again.
Thanks.